of Health meeting to order. Thanks everybody for being here. For those of you on screen, if you're able to turn on your cameras, always appreciated. If not, we understand.
Howdy,
Oh, hello.
how are you doing?
Good. Thank you, everybody. We'll just let Commissioner Roth get his seat here real quickly. Okay, let's go ahead and spend a couple minutes and review the agenda.
Madam Chair and members of the board, I just want to notify you that Jess will not be here to do her suicide prevention update. So that's one item that we can reschedule for another month.
All right. Any other changes or additions? Not hearing any, we can then move into the minutes. Please spend a few minutes and read through them and let us know if there's any changes or additions to the minutes from the October 27th meeting.
Gosh, that was a while ago.
Okay, any changes? All right, then approved as written. Thank you. And we can move right into the board discussion. Mary, would you like to give us a WIC update?
Hi, everybody. Thanks for having me today. I'm going to try to share screen. Hopefully I can do this correctly. How's that look?
It's still loading, but you're sharing. So
Yeah, I can't. Taking a little bit. The Wi-Fi has been a little up and down lately, so I'm hoping this is going to work. Otherwise, I can walk downstairs and talk to you. just won't have slides.
well, we can hear you just fine. It's taking a minute for your slides to load. So
Okay. I'm going to try something. Now it's not letting me even stop. Oh, okay. Try something else here.
There we go.
Okay. Unfortunately, oh, it's not. Oh, there we go. Now, if I could just start the slideshow. How did I do? Can you see that?
that'll work. It's in presentation mode, but we'll take it.
Okay.
Or
Sorry
no.
about that. There's probably a way to fix that really quick, but
No worries.
anyway. Again, hello, everybody. I'm Mary Sparks. I am the Family and Child Health Supervisor. That's a new title for me since October. So I'm getting used to saying it. It doesn't roll off the tongue very easily. I've been here at Lewis and Clark Public Health for 5 years as the home visiting supervisor, and more recently have been acquired WIC as one of my teams. So I'm going to do my best with presenting on WIC because I'm new to it. So I wanted to talk to you a little bit about what WIC is for those that may not be as familiar with it, and then just talk a little bit about what our updates are for this year. And so our team includes Maria and Sherry, who are our registered dietitians, Vivi, who is our clinic coordinator, and Charity Krebs, who is our breastfeeding peer counselor, and also our WIC aide. So the WIC program aims to safeguard the health of low-income women infants and children up to the age of 5 who are at nutritional risk by providing nutritious foods and supplemental diet information on healthy eating and referrals to healthcare. So that definition is a little bit misleading because WIC isn't just for pregnant women and women, infants, and children, which is what it stands for, but it can also include parents and guardians, grandparents, single fathers, and foster parents. All participants have to have a household income eligibility, though. So our program here at Lewis and Clark Public Health, we serve an average of 800 participants between Lewis and Clark County, Meagher County, Jefferson County, and Broadwater counties. That anybody can actually choose to go to any clinic that they wish in the state. It's just usually they're trying to get to the one that is closest to them. The WIC program works closely with the home visiting program, which is kind of handy because I supervise those programs as well, that we have created a more comprehensive and program where the information and referrals can flow a little bit easier between those programs. We also have 2 special projects, the Farmers Market Nutrition Program and the Peer Counseling Breastfeeding Support. WIC is also one of the primary referral sources to many other social services and is the biggest referral source to our home visiting programs. So the WIC program provides nutritional counseling and education visits. They have 3 visits with a registered dietitian in a year. We now have in-person appointments available. Since the pandemic, everything went to phone visits. But now we are seeing some people who want to come in. They can certainly have an in-person appointment, and then new participants as well as pregnant women and new babies are coming in for at least an annual visit. The food benefit packages are based on certain categories. It depends on the age of the child, any dietary needs, and food preparation needs. All approved foods are listed on the WIC website, the Montana WIC website, and is updated annually. So I want to talk a little bit about our farmers market program. Vivi really is the one that coordinates the farmers market program. Each participant can qualify for an additional $30 per participant to be able to use on the approved farmers at the farmers market for locally grown produce. And Lewis and Clark has been consistently one of the highest redemption rates in Montana for the farmers market program. That was highlighted in our WIC monitoring that happened in October, so I'm really proud of that. Charity, again, is our peer counselor for breastfeeding support. She's been with us since right in the middle of the pandemic is when we hired her. She works with pregnant and breastfeeding individuals receiving check-ins from Charity and one-on-one consults. We can provide hospital-grade breast pumps to eligible participants. We have personal electric pumps available to eligible breastfeeding participants who have successfully and exclusively breastfed for over 3 months. And hand pumps are available to breastfeeding participants, as well as other breastfeeding supplies such as breast pads, freezer bags for milk storage. We've been working on outreach efforts in the community. The team attends community events and has tables, been promoting breastfeeding within our social media, and has ongoing communications with healthcare providers. We also just wrote a grant to, actually it's to the Parents as Teachers national organization who had challenge grants available. And we wrote a grant to include outreach materials that would include all the programs that are considered children's programs for Lewis and Clark Public Health. So that would include Parents as Teachers, the Nurse Family Partnership, WIC, as well as the lead education program. We also host 2 interns every year. They come and they spend about 2 weeks with the team. They observe and participate in nutrition and breastfeeding counseling sessions, and will participate with any WIC outreach effort that might be going on. The last intern we had in October was able to sit through the whole monitoring process. So that was kind of a neat thing for her to see. WIC also provides referrals to other services in the community, including, of course, home visiting, but also medical care, behavioral health, education and career training, housing support, Head Start or early Head Start, and childcare connections. So one of our biggest challenges is that WIC is underutilized and underfunded. It is a national program, but the rates of participation are steadily going down over the last several years. I had pulled up some of the statistics from 2020 that shows the national average of eligible people is over 12 million, and the number of participants is over 6 million. So that's about 50%. But in Montana, we have 40,000 who are eligible and 14,000 that are participating. So we have a lower overall participation rate. So let me go back. I want to just to talk about that a little bit more, is the reasons why I think that it's underutilized. I don't think there are some research about why it's underutilized, but they include difficulty dealing with bureaucracy, immigration concerns about status vulnerability, lack of transportation, not speaking English, stigma, not knowing about eligibility, and we need more outreach efforts. One of the priorities that I have as a new supervisor for the program is to try to go through the program as a participant. I kind of pride myself on being a supervisor over the home visiting programs because I received home visiting services through Part C early intervention when my son was little. I've never received WIC, and so I'm not participated. So I want to make an appointment and have and go through the whole process as a participant to see how difficult it is. Access to services is a priority of mine. I'm working with the state to try to allow me to do that. Hit a little roadblock there, but I'm working on it. So some of the celebrations we have, as I said, we had our WIC monitoring, which was the first one, in-person one since the beginning of the pandemic. So we had our state partners here for a couple of days looking at everything and observing appointments. And so after that monitoring was complete, we are classified as Tier 1, which is the highest ranking tier. We have flexibility in participation. That was one good thing that came out of the pandemic, is that we are allowed to do phone visits, which has really reduced the rate of no-shows if they can do an appointment over the phone. And then another success is that we are seeing families, new families and pregnant women and babies in the office in person, which gives us another, I think it increases just the relationship between the staff and families. And we mentioned that I'm the new supervisor. I don't know if that's a celebration, but it's a celebration for me. So hopefully they think the same thing. I just pulled up this YouTube video. The slides will be presented to you. I didn't have time to get them in the packet, but we'll be getting that out to you. If you do want to see a little YouTube video on the history of WIC, it's about a half an hour long, so it takes a little bit of time, but it goes through the whole history and how it came about. Is there any questions?
Just a comment, if I might. I'm really impressed that you're willing to try to see what the participants are going through personally.
Well, I
And
think
I think that's really important. So many times in in county government, we're doing things for folks, and it's pretty hard to get on that side and understand what the roadblocks are. So thank you for trying to do that.
Yeah, thank you. I'm like I said, I have hit a little roadblock with the state, but we had a WIC phone call this morning, and they mentioned that there is a way to do a test card. They can't put me in the system as a participant, but they can give me like a test card so that I can actually go to the grocery stores, try to find the WIC approved items, and that can be a real challenge for people sometimes. So I'm kind of excited to be able to do that. I think we really need to understand how we're providing services to be able to provide good services.
Yeah, I think you're doing a good, yeah, if you're trying to do that, try to understand what the folks are going through that are receiving the services. I think you've got the right attitude. Thank you.
Thank you very much.
Mary, I had a question. Sure.
Yeah.
How's it going with the breastfeeding peer counselor? Many moons ago, I was in that role and it was difficult to get people to engage. I was just curious if that's still the trend or if you guys have cracked the nut yet.
No, it is still challenging to get people to participate in that. Charity, it does a great job, and she's been consistent. Obviously, she was hired during the pandemic, a really difficult time to be hired anywhere, but she's stuck with it. And she's also become our aide now, so she has a full-time job. So that means she is here and available to people, especially as they're going to be coming into the program, into the facility more. So there's a little hope that we'll have a little bit more connection there. But as you know, that her services are available to people as a peer, even though she has her certificate as a lactation consultant. She's not really allowed to use that with participants because it's really supposed to be from mother to mother who receive WIC and how they are breastfeeding. So that becomes a little bit challenging to try to separate that out.
Well, that sounds like a smart fix to have her around and yeah, well, thanks for that. I was just curious if it was similar or different.
Yeah,
Anybody else have any
still challenging.
questions? Yeah. Anybody else have any questions or comments for Mary? Okay, thanks for the update, Mary.
Thank you.
Yeah, you're welcome. Next, I'll invite Jennifer from the Water Quality Protection District update, please.
I think she said that she was having some issues at the moment. And I did see that she stepped off of attendance. So maybe we could go to a different one.
Let's go ahead and move to Jolene with the behavioral health systems update.
I will jump in. Hold on.
Thanks for your flexibility.
Yeah. Okay, looks like we are in the right presentation mode. Is that correct?
Looks like we are not in the presentation mode on our end.
Let's see. I'm gonna stop sharing. We'll go from the beginning. Huh. From current slide. Nope, won't let me switch over. Let's try it again. No, I can't get it to change.
That's okay, Jolene. We can see your slides, so just run through.
Thank you.
Yeah.
Yep.
You'll
Yeah,
have
it's
to
funny.
click-
It
Yep.
looks like it's on one sheet, on one screen on mine, but it's not showing through on yours. So I'm Jolene Jennings, Behavioral Health Systems Improvement Specialist at Lewis and Clark Public Health. And thank you for inviting me to report on the behavioral health work that I'm involved in and have been involved in since June 2020. And I can't believe it's been almost 3.5 years. So I'm going to jump right into the first slide that shows the behavioral health crisis and continuum of care, just to give people who have maybe not been on presentations before, just a visual for the full behavioral health crisis to continuum, which includes prevention, early intervention, response, and stabilization. And during my time, I have been focusing on the response and stabilization, and also a little bit of the early intervention with 988. But just to go back a little bit and give people some background for some of the work that was done in the first year or two, we had worked on mapping the behavioral health crisis response and stabilization, and with our behavioral health providers, emergency rooms, law enforcement, and the hospitals, Shodair and St. Pete's were the primary mapping systems that we used. Also, we produced a behavioral health crisis system analysis in 2021 with JG Research and Evaluation, who was hired under one of the grants to work with us. And so we were able to provide some robust data to have facts for why we were identifying these needs in the community for behavioral health crisis response and stabilization and a continuum of care. Secondly, for reporting, we had worked with, again, under one of the grants with Western Interstate Commission for Higher Education for Montana Crisis Receiving and Stabilization Report. And that was, again, something that I worked on with them, and also the leadership team, and our LAC had some inclusion in that too. So those were some of the early days. And we have done mapping, and we did the mapping in 2020 and again updated it in 2022. And then hope through one of our new staff to be able to start work on that again next year. And that's with substance use disorders and prevention and behavioral health work. I also wanted to highlight our accomplishments, recent accomplishments, which was, including building the Crisis Now model, educational resources and robust public-facing data, which was something that was identified as being needed. And so we produced the behavioral health infographic, which was handed out in your packets. That was a one-page format that we were providing to share this, the process of what we were working on in the community and the accomplishments and also the needs. And so that was quarterly. And then once the behavioral health crisis system dashboard was created through the work of the LAC work group, and also myself and Dorota, who was our epidemiologist here, that was launched in August. And that will replace the behavioral health infographic handout. And instead of quarterly, we'll be still repeating that once a year, just so people have it as a handout. And I guess I want to ask, before I assume people don't know this, has anybody seen the crisis system dashboard, or would you like me to open it up? I have it on a link here.
I feel like she showed it. Yeah, go ahead. Everybody's saying thumbs up.
Thumbs up, you already saw it, or
Thumbs
wanna
up
see?
to open and
Okay, let
share.
me-
Yeah.
It's spinning.
And you'll probably have to share a new screen too. You'll have to stop sharing your presentation and then share your Yeah, there you go.
Yeah, I found out a new way. You don't have to shut it down anymore. You can just do a new share and it opens up.
Oh, nice.
They're always adding new features. So this is the welcome page. Whoops, we got the welcome page right there with all 3 pillars. A little explanation, contact information there too, if you want to reach out and have a comment or make a suggestion. And then there's a tab for each of them where we get into detailed data that either is the program's deliverables on a quarterly basis, and then often goes back to the start of it, such as since Q1 2003, we've got 758 behavioral health responses for MCR. Whoops, that's the 90-day, sorry. And the latest quarter, which shows an increase or a decrease from the previous quarter. And then those are the actual numbers from the 988 Voices of Hope for Lewis and Clark County. And then we also blend in behavioral health services that correlate with why there's the demand for these services, such as we obtain the 911 dispatch behavioral health coded calls from law enforcement on a monthly basis and enter that in quarterly. And so we get the total amount of behavioral health related calls, protective custody calls, and the total of those that are showing the demand for services in our community. And so that's a similar kind of practice on each of the pillars. I won't take too long here because I know we have a few things to go through. Again, so up-to-date pillar for MCRT responses since we started is 1,087 responses since November 2020, which was a slow start, and then increasing twofold in this new fiscal year. And so there's a lot of data buried there that you can look around at. Again, you can see the increase here in the first quarter. It's the highest since we started for 166. Wow. Which is a good thing because we're getting more referrals from law enforcement than we had before, and that's a primary increase. And so they're referring more like 50% versus 20%, which is developed over relationship building and the system with law enforcement and behavioral health. And the pillar for the crisis facility was put in as the third pillar, and we are still working on that. But that is right now just feeding in data that shows why we need these services in the community. And again, we're partnering with St. Pete's to put this emergency room disposition and behavioral health visits, that data goes in there. And that data is sent in through an Excel spreadsheet, and then I break it down and put it in with Darota's assistance, of course. And so this is a great tool, and I'm really happy to hear about different people using this in the community. And before I jump off of that, is there any questions on anything people have? I think I do have to stop sharing this.
Jolene, I have a question.
Sure.
The term behavioral health is so broad. Do you, as a health department, receive any more like drilled down data on what kind of behavioral health calls are coming to the emergency room? Like, is it substance use related or more?
We're asking them. We're asking them that in the future. St. Pete's has gone through a change in their reporting framework, and so Epic system has gone into place, and it took a little while to get that going. But being able to ask for data quickly is not possible. It takes about 6 months to be able to pull that into framework data that we ask for in reporting. So we are asking for a breakdown of just right now. The state is asking for serious mental illness and mental illness and substance use disorder general. We're not asking for specific diagnosis codes, because that just would be really not easily to be able to be reported, but it would give us the start of understanding, that basic behavioral health, substance use disorders or co-occurring disorders.
Thank you. Does anybody else have any questions about the dashboard before Jolene moves on?
Okay, I'm gonna
Just wanted
stop.
to comment that Jolene was able to supply some really good material that we passed on through the first responders in the county, because there seemed to be some confusion about the new numbers 211-988 and how it related to the 911.
Oh, sure.
And she found some really good information that we passed along, and anyway, I think it's maybe going to start clarifying some of that. She had discovered that there was still a lot of confusion among the first responders. So, yeah, I think it's really appreciate that.
Jolene, if you have time within your presentation, just like a minute or two of what a mobile crisis response looks like might be interesting to hear.
Yes, I would, but I think it might be nice, and I'm gonna do this again to you, is we do the 5-minute presentation on the YouTube. I think we have time to do that. And I will go into a little bit more on some of the specifics of the Crisis Now model. But this is something that we participated in and collaborated with DPHHS and Montana Public Health Institute. Lewis and Clark agreed to be videotaped and present their work. There was actually, I believe it was like almost an hour recording, and they whittled it down to both 15-minute and 5-minute presentation. I will let you go to 15-minute on your own time, but I'm going to click on the 5-minute and we should be able to watch that. And I think that'll give you a little bit more understanding of the work that's been involved across the state and a little bit in the county. And then I can get into some more local stats. Is that okay?
Please, thank you.
Thank you.
It does a good job of describing MCRT. There's an MCRT representative that's on them.
Nice.
Can I just ask, are you able to see this and hear this?
No, ma'am.
No.
Okay, that's what I wanted. No? All right, let's see.
We're still on your presentation. And then don't forget you have to share sound as well.
Yeah, I did. I'm not able to see that choice on my my drop down for, I don't know, Jolene, can you hit it on your screen that says allow me to hear sound?
It doesn't allow that on unless I'm sharing a screen item.
Okay.
So if you
All
hit
right.
the share screen, then it says share sound on there, as if when you do it for your item.
All right, so if I stop sharing my presentation,
Yes. And then when you hit share again, it should say that on that menu to share sound.
On the left-hand side, lower left.
on the lower left. Yeah, that's unusual. Yeah, because I don't usually get that. Yeah, I'm not seeing it on the lower left. So,
Are you in your office, Jolene?
yeah, I am. I think she's coming
All
over.
the technical difficulties.
The
figured out during
essence of a
pandemic.
hybrid.
I was hoping that when we ended COVID, that maybe I wouldn't have to deal with this, and now I guess I'm gonna have to learn.
Yeah. Oh, there it is. Okay, thank you. Oh, hold on. Select option if you want to hear. I did. Whoops. Unless we click on that share and say share again. Here, and then it'll bypass it. Yeah, bummer. How about advanced? Up at the top here. Hmm. Yeah. Bummer.
If I had the link, I could show it, I could just put it on.
I can email that to you or put it in the chat, and we can always go back to it. I'm just gonna put it all on the, should be there. I think this is it. Yeah. All right, so Brenda, we couldn't figure out how to do that. I think it's, again, when it's managed by somebody else, it's a little more challenging. So I think she's going to try to open that up from a direct link and a separate screen. And while we're waiting for her to do that, I can just talk a little bit about the current programs and initiatives. So I just want to say, again, behavioral health, well, we talked about that. Hold on, let me just jump. The 988 Suicide Prevention and Mental Health Crisis Lifeline was launched in July 2022 after 1 year of planning with the state. We worked with across the state, the behavioral health crisis coordinators, which is also my additional name, worked with the state for about 6 to 8 months to identify different categories of strategic planning in the strategic plan to prepare for it, especially because in the area of marketing, there was no funding. And so we all had to start collaborations, outreach collaborations, email communications, presentations at various coalition meetings to try to get the word out to prepare for it. So that was an important part of the 988 launch. Voices of Hope Call Center is the 988 call center for Lewis and Clark County and a third of the state. And so we get reporting from them for every quarter. And in the last quarter, we had, I'm sorry, in the last year, I have down for stats that we had 596 behavioral health calls. Out of those 596 behavioral health calls, 503 or 84% were able to be de-escalated by the crisis counselor on the call. Oops, sorry, I'm not used to this system. And that is the goal. We want to see, 70 to 80%. Actually, Montana is one of the highest rating for de-escalations on the phone in the nation. And so I think it was due to their really solid call centers that were set up, whereas a lot of states didn't already have that system set up where that can be where we launched the additional 988 into the 211 call centers. And so now they take both calls and they have specialists assigned as crisis counselors on the 988 system there. And so statewide, it's an increase of 30% for behavioral health calls. So they're doing their job there as the first pillar for the a person to call in crisis, behavioral health crisis. And then the second component is our mobile crisis response team, which is in its third year as of last month. Hard to believe. And that's our pillar 2, which has been operating successfully for 3 years now. Obviously, in the first 2 years, we had some really solid funding with the county tribal matching grant and crisis diversion grant that the county applied for on behalf of that service. And we've been working the past year and a half on trying to build Medicaid sustainable funding in, because the intention was to start removing that service from the crisis diversion grant to transfer over to other systems such as the crisis facility. And so we're still pending on that. We've had MCRT, jumping ahead here a little bit, has had 2 public hearings for that Medicaid policy, and we're hoping that's going to be finalized and approved to start on reimbursement or billing for January 1st, 2024, because there is no current crisis diversion grant funding planned for the 2024. And so we're watching that closely and communicating with our partner, St. Pete's Health, on that. But I just also wanted to highlight that the total responses last year for MCRT was 347. And out of those 347, the benefits of having the MCRT in the community is 245 or 71% last year were able to remain in the community and be treated in community or in their homes. Majority of them are treated in their homes and remain there, and just receive the de-escalation through a behavioral health professional and also a mental health evaluation on scene. Our statistics are currently 81% of them are receiving mental health evaluations on scene. The others that aren't typically receiving them on scene are those who have been decided to go to an emergency room, or are in maybe receiving a safety plan instead, or are receiving another form of intervention such as EMS or law enforcement. So that's a pretty amazing statistic to divert from the emergency room and law enforcement. And again, we talked about 1,087 since the initial launch of MCRT for our county. Lastly, for MCRT, just want to say for what's newly developed for an initiative is the MCRT Community Coalition, which was approved by the Behavioral Health Systems Improvement Leadership Team through their strategic planning this year, that we needed to dig down deeper into not just the larger picture of the crisis system work, but also once those pillars are up and launched, like working more intensely and closely with them on operations, sustainability, and also through the discussion of expansion into tri-county community. And so that's a big part of what we're doing, and it's very new since August this year. So we've met 3 times and things are going well. And lastly, the crisis facility has had 2 RFPs in the past year, and we're pending at this time with movement forward on a contract, but the provider who has been interested in it is in discussion with the county now, because we have not gotten any further applicants for the second round for the crisis RFP that was required to be sent due to some changes in the RFP with funding definitions that were not in it originally. We had to do a repost about a month ago. And so the county's going back to discussions with Many Rivers Whole Health due to that no other interest in that for a behavioral health provider. And we hope to hear more details on it. Brenda's been working in some discussion with them on sharing their information and updates at the Behavioral Health Systems Improvement Leadership Team next week, which is Tuesday, December 12th. So one other thing I could say is we are, the county is working on updates to the Journey Home Crisis Facility to make it more ready to open in regards to some things like replacing the floor from carpeting to laminated so it's able to be kept sterilized, and purchasing some other equipment. And then really a big expense is security equipment in there with cameras and safety equipment. So that's what's happening in the crisis facility. And I think I already mentioned a little bit on the Medicaid MCRT policy. And the last thing I would say is the HB 872 is the Behavioral Health Future Generations Commission. And that is something that many of us have been following and sharing information and and encouraging our local advisory council members to attend and participate on our central service area authorities to be engaged in. I know I'm on the CSAA board too, and we've given up our meeting date to be able to participate and join in on that whenever that's available on a monthly basis. But I'm happy to say that at the meeting on November 30th, the commission did recommend through a near-term initiative that the crisis system work for mobile crisis response and crisis stabilization or crisis facilities was recommended to be have a year's worth of funding immediately. And so that's gone forward to the governor. I don't know the process beyond that, but that is where we're at. And so that is part of the answer. Any questions on that? I know Bree, you were interested in knowing more about the programs.
Well, I think we can just watch the video. I think that'll be fine.
Are you ready for the video, Brenda?
If you want to, sorry, stop share and then I will select my sound if it's gonna let me.
Before we push play, does anybody have questions about the crisis facility or any of that? There's so much going on.
Yeah, it's busy time.
I wonder if there's something wrong with the Zoom itself. Let's see, because it's not allowing me to select my share sound.
Oh, yeah, that's the same problem Jolene was
That's-
having.
yeah.
The other Jolene.
And I have it ready, I believe. So I can just try it and see what happens. Just give me another second. Try it again. Optimize. Can you hear it?
No.
Okay. Well, what I could do is just send it out in an email to everyone, and then along with her 15-minute video one.
Perfect.
That'd be good.
Okay.
Yeah, I
Great.
can try it from my side too here really quick, and then we can move on if it doesn't work from this.
Sure.
Mhm.
I have it queued up too. So go ahead and stop share on yours.
Yeah, just a sec. Let me get to my. Hold on. Oh. All of my things are missing. There we go.
Let's do it for you.
All right.
So much for the great features that Zoom has just updated.
I know.
Every year, nearly 300.
Hold on, just.
Hold on. Three tries.
Every year, nearly 350 Montanans die.
Share screen.
Yeah. Haha. Think I got it.
A sound.
Oh, it sounded very loud.
This screen.
That was really loud. Well. Now that I've shared it, it's not wanting to load. Well, darn.
Well, it wasn't for lack of effort.
We tried. Yeah. And while Trent is trying that, and interrupt me if that happens, I just would wrap up with the last slide for sure. And just
I
say
don't want to play.
it doesn't want to do it. Yeah.
Great.
So you need to stop sharing for me to access. But I think we don't need to have the slide up for me but focus, the last of it was a future focused is regional crisis system expansion, crisis facility, which we talked about. Youth, I just wanted to say a little bit more on that, as our focus has been on adults need behavioral health services, but youth are receiving responses by MCRT. The numbers are increasing, going into the public schools primarily, in a higher volume. So we have been inviting Helena Public Schools and East Helena Public Schools to the table for the MCRT Community Coalition to understand what is happening, what we can do, and they're learning more about some of their protocols that can be improved. And then through the local advisory council, which is another key component of behavioral health work, is we invite, I tend to invite and spotlight behavioral health provider that focuses on youth. Recently, the Big Sky Youth Empowerment Program as a best practice to share for peer-to-peer and peer groups, and Rural Behavioral Health Institute, which shares linkage to care, which is about youth assessments in the school. Those are just a couple that we've had in to try to start adding that component in for the behavioral health system work. And lastly, I would say is the law enforcement component is definitely huge for behavioral health work. They're engaged in the coalition groups, very dedicated, coming every meeting for the MCRT Community Coalition, Sheriff, Helena Police Department. We have Jefferson County Sheriff there for the first time just this week, and then also just this what's today? They were here. Well, it was Monday we had a very full day. That was that meeting, and it's incredible conversation and sharing and dedication to seeing the MCRT work in the community, because they, as I leave there in the quote, one of the Lieutenant Zapata said, he doesn't after having MCRT correspond on behavioral health code calls with him in the evening shifts, he doesn't see why anyone would not want them partnering on scene during these calls. He feels their absence whenever a team member is out sick or on call, on another call and can't make it to one of these scenes with him. He said he's doing everything he can to share with officers that are new coming on the importance of having them on scene. And part of that is why we're seeing the numbers double, that we have buy-in and support and peer-to-peer communication on the success. Thank you.
Okay. Board of Health members, any comments or questions for Jolene or thoughts about integration?
And Jolene, I think you said this, but we probably were off at the time. When have they set a target date for the crisis home, the journey home?
I'm hopeful for next year.
Next year, okay.
I'm hopeful. It may be summer now, but
it's all about sustainable funding, really. To we all want the crisis facility to open and stay open, and not be open for a year and close because of unsustainable funding. And so that's a big part of it. But Drenda's able to. Drenda's working on most of this now, so she could answer more than I.
I'm glad to hear that the 872 Commission is dedicating funds to crisis stabilization facilities, because that is the biggest hesitancy of many rivers to open those doors. Is at this point the numbers don't pencil out.
No.
So
have they been able to do any work on that bundle data, the daily charge bundle?
the Medicaid reimbursement's already in place. It was in place last year. So
Well, there was a change, wasn't it in June or July, something like that?
they increased it a little bit.
Yeah, but it wasn't enough.
Well, it's enough for those that are Medicaid eligible. The issue becomes when you have, when the facility's not full, or when you have people in the facility that are not Medicaid eligible. So there's only a small percentage actually that would be served by a Medicaid reimbursement, which is not enough to cover the full operations of the facility.
So have they been looking to negotiate contracts, Many Rivers Whole Health, negotiate contracts with private insurance, the commercial insurance?
There is some private insurance that will pay.
Commission's hesitation is the idea of just getting it started opened and we don't have a commitment that's longer than a year. And thinking that it's probably more destructive to open it and then to close it than to wait and try to open it and more long term.
So it's really working through these sustainability conversations, making sure that there is sustainable funding to keep the doors open once they open.
And I think the population we're trying to serve, they need that consistency, you know? And they need to know that they can go there, you know, when they have a problem.
Yeah, and I would say crisis system work, you're going to set up a facility and say, please start bringing people here for medical or for behavioral health crisis services. You have to build the trust that that's going to be there. So law enforcement and other community members, providers would start referring people there. And that's key to making the success. We hear from different crisis facilities in the state is you have to have as close to full beds as possible or seats possible to make this sustainable. So, and there's a need, it's just, you need to have the trust of knowing facility is going to be there too.
And it's difficult because those clients can also just opt out too. They can walk away. You can't hold them there. Can't be court appointed. So I mean,
The judge can
the judge.
require it, but that's only if the provider chooses to have a involuntary section of the facility. Right now it's set up to have involuntary beds, but it's only the courts that can force that. Mhm.
Do we have, near as I can tell, we don't have a system like California has where you have a limited conservatorship set up. They have a limited conservatorship and a permanent conservatorship, and the permanent one is only a year and has to be redefined by by a judge. Extended whatever term it's used, but that's the only way we can force people to take meds that they need. Other than that, my understanding is the only way you can do it is to have them in Warm Springs.
State hospital. Yep.
Yeah. So going to have to be some legal changes made to.
Yeah, I think that there's some work to be done at the legislative session on.
And I'm sure there's concerns about taking people's rights away, but there needs to be a medium where we can
Help at the right in our local community and not have to go to the state hospital. Looks like Jennifer's back on.
Okay. I would just say that besides the facility, I don't know if Mary's still on, but a couple years ago when I was in my old position, we did a behavioral health mapping exercise specifically for moms because suicide and overdose are the #1 cause of death in the year postpartum. And the question really was if a mom was having, if a postpartum or postpartum mom was having suicidal, was experiencing suicidal ideation and she called what does that look like for that child, especially if she's a single mother, and where does that kid go? And how does our community, and we did it across the state, but how does our community wrap around that child at that point in time, and what does that all look like? And so I just wanted to say that I don't think that anything ever came of that, work, other than a commitment that it would be great to pick it up if and when there was ever like capacity, because it was during COVID. So maybe Jolene, and Mary, you would be able to pull up that, and bring it to the leadership group for at some point if the topic of motherhood and behavioral health comes kind of up. I know that it's, just one segment of the population, but I just wanted to make sure that you knew about that work that had happened. We didn't really get any traction with any of the groups across the state at that point, because I think everybody was just kind of
Yeah.
doing the bare minimum to survive at that point, but it might be time where somebody could take a look at what the Helena community said. There was a lot of interest, I remember.
Yeah, I know. I remember you working on that. And if you have specific information for Lewis and Clark County, I think that would be great to put that in the pool of our data with our EPI and see if, we can think that through a little bit. But you hate to have data that, you work so hard to pull together and not to be able to utilize that and share that with the community. So, yeah.
Was that a Healthy Mothers, Healthy Babies project? Can we get the-
It was it was a project, and I think it was less about data and more about process of, if the mobile crisis unit, I just remember back in the days of being a home visitor and encouraging mothers with suicidal ideation to, call the hotline, and, the sheriff shows up and they go into the back of the police car. And that's just not a very nurturing experience, especially if there's then a child. Is there car seats? Like, where does the baby go? What if they're breastfeeding? I mean, there's a whole lot to think about. And I think, when we're trying to build comfort with the systems, like to make sure that, all of those different types of people and like the dyadic approach to like this specific population, just knowing that it is the number one cause of death. Just wanted to advocate and put that back out there, because I just don't think we really thought about it, and it was kind of horrifying the first time I saw that happen. It didn't really, there's really no better option probably, but I really didn't know how to, support a person through that process, especially if there's no father and no parents in town. That kid then goes into foster care.
Sounds like there's a couple layers. Yeah.
So many layers. Yeah. So I just wanted to kind of put it back out there, because there's no better group than the health department and all its coalitions to think through these complex layers of care, for sure. So thanks for that presentation, Jolene. You
Thank
and the community's been so busy and invested. You can really tell. And the commission too. I mean, everybody's really working together. Jennifer, we see you're back. Hopefully, we've been having lots of technical difficulties, so you're in good company, but maybe yours has improved. If you'd like to present your Water Quality Protection District update to us, that would be awesome.
Sure. Can you hear me? I'm at Valerie's computer right now.
Yes, you were just a tiny bit muffled when you started speaking, and then it got clearer. So we'll give you a heads up if it sounds funny.
Okay, sounds good. So I do apologize with all that happened with the computer. And I do not have any presentation as others had. So I do apologize for that as well. Hello, everyone. Jennifer here with the Water Quality Protection District. So just really quick update. I'd like to start off by saying the Water Quality District is fully staffed. We filled our vacant hydrogeologist position that has been vacant since February of 2022. Our water quality specialist left in October of this year, and our new one started mid-November. And she hit the ground running, and she's out been doing field work ever since. So I'm very happy with that, and now able to start looking forward with developing some work plans and continue with our monitoring and sampling. Second, we've had a Big Sky Watershed Corps member these last 2 years, which has helped out immensely with our outreach efforts. and conducting field work both in groundwater and surface water. We've been able to work with our partners and hold water conservation events, keep up on our social media outreach, and also help plan for our annual Lake Helen Watershed Festival. Our last member followed up on a small water quality study looking at nitrates, arsenic, and uranium in the Unionville area with our assistance, of course. And we did not apply for one for 2024. See, we have a new story map that we've been kind of displaying and talking about. It displays our water level network. We will be revamping all our story maps that are currently on our website that will include our water quality data, water quality projects, and the restoration work that we've done over the years. This also includes the 10 Mile Creek flood zone that is a site for homeowners to check both water levels and creek levels in that area. This can all be found on our water quality district website under interactive data and mapping site. Finally, I'd like to mention that staff and I have been discussing new ways to present our data through our website, social media, videos, but also through educational events. Encouraging homeowners to test their wells is a big one. We have a free program that is going on right now that most of you probably already know about, but that any homeowner that lives in Lewiston and Clark County can come by our office and get the materials to test their water for arsenic and uranium. And this is possible due to some ARPA funding. And this also helps us with the data side too. This is a great technique to get data to kind of fill in some of those gaps that we see. We also have a Watershed Festival that we'll be working on for 2024, working with our partners, including GardenWorks. I know that the last couple of years we've been working with them, especially on being water wise, especially during those irrigation months. And then also continuing our very successful Water Watchers program that targets all 4th and 5th graders in the Helena and East Helena schools. And for collecting data, as I mentioned before, we will start on our work plans for our upcoming field season, conduct annual water quality testing of network wells. We're also thinking about creating another free residential program that looks at manganese. Do you, and that's the end of my presentation. Do you have any questions?
Good. One of the real interesting things about being a new commissioner is I've been able to spend a pretty good chunk of my first 3 years attending the water quality meetings, and it's something I don't think that the general public realizes how much is being done there. And it is really important work. I think they've done they're really trying to do some good things to protect people and improve all the problems. I didn't know how much I didn't know, until I got to go into their meetings. So.
And just as a reminder, Madam Chair, the Board of Health still needs a representative on the Water Quality Protection District. Lisa Kaufman was that representative, and she's not able to do that. It's a once a month obligation. The meetings are the same week as the Board of Health, and it's in the evening. It's a 5:30 to 7:30 timeframe. But the board at this time does not have a representative to the Water Quality Protection District, and we should have. So,
Are they in person or Zoom?
it's a hybrid still, similar to this meeting.
They do have a couple times a year they do tours. They go out and do a tour of an area that's been worked on, or look at some of the water quality plants. Get a better idea of what the problems are.
I think I'm finally ready to volunteer.
Are you?
I did, yeah.
Yeah, Jennifer will be thrilled to hear that. Did you hear
That's
that?
great.
That's wonderful news. Thank you so much.
You're welcome. It's time I learn about our water here in this beloved community.
That's great news. Thank you.
Mhm. Okay, any other Board of Health?
Does that require a vote?
Does that require a vote? Good question.
I mean, I think most people are probably in favor. I'll make a motion. Doug, they'll second.
You still have a quorum and I would recommend that you go ahead and make it formal and official.
Second.
I'll make a motion that
Whichever.
Brady becomes the water quality district representative of the Board of Health.
And second.
All in favor?
Hey.
Great. Now we have a Board of
I
Health.
just wanted to make
representative.
it extremely official because that was one of the things that we always found. Thank you, Bree.
You're welcome. Okay, on to our health officer report.
Great, thank you, Madam Chair, members of the board. I just have a couple things to share with you today. The first is budget related, and I've tried to keep the board kind of apprised of our budget situation. I've been working essentially since we finished up fiscal year 24 budget this past spring, so March, April timeframe. I've been working on the fiscal year 25 budget. And the reason why we've put so much effort into planning for this next fiscal year is because the last couple of years, our budget has been pretty strained. We continue to have inflation-related increased expenses, specifically related to, well, everything, but we've felt it pretty hard with our rent, our personnel expenses, and our IT have been the most significant increases, although everything's increased. So, and we're not the only ones feeling that, but our revenue is not increasing at the same pace. And we've been so very grateful that the county commission has supported the health department budget with CARES Act funding the last 2 years. But we're looking to balance a budget for fiscal year 25 without support from the county commission. So several strategies have been discussed, and I wanted to give you an update on the strategies that we're currently moving forward with. And so 3 in particular, we are doing a reorganization, and that reorganization will be going from 3 divisions. So right now we have Community Health Promotion Division, Disease Control and Prevention Division, and Environmental Health Division. Kathy is retiring, which is next on the agenda. And so at the time of her retirement, we will be going from a 3-division department to a 2-division department. So we will consolidate disease control and prevention and environmental health together. They will have to come up with a new name because disease control and prevention and environmental health division is not an option. It's too much to say. So once Laurel will be the division administrator overseeing the new division, they will go through a process of getting, renaming, doing some team building. Laurel will work her magic with pulling the division together. So that's one big change that we'll see starting next week, essentially. The other big decision that was made and we'll be moving forward with here in the spring is that the environmental health staff that are currently located in the city county building will be moving over to this building here at the main Murray building location. So that will be an environmental health and water quality staff will make their move over. That will save essentially $46,700 or $47,600 in rent by consolidating us into one location, which you all know that we've talked about the importance of the health department being in one location together. Ideally, it would not have been in this space because it's going to be pretty tight to bring additional staff into the building. We're going to have to do some shifting and moving around and creating new spaces for staff to work out of.
ideal scenario would have been finding a new location for all of us to be together. That's a little bit more adequate, but for budget purposes, that this is one of the things that we're gonna use to save some money here. And then the third piece that I wanted to give you an update on, is that there will be some staff positions that are impacted as well. And so, that will become more clear in the spring when we start to put the budget together. Right now, I'm in a holding pattern, waiting for a couple of key pieces of information to come from the county. So I need, in order to really put real numbers to paper, I'll need personnel numbers, I'll need rent numbers and IT numbers from the county. That all normally comes right after the end of the year. So starting January, those numbers should start flowing in, and we should start being able to put an actual budget together for fiscal year 25. But in preparation for, those are the things that we have decided on at this point and wanted to give the board an update. We also have some revenue generating strategies in the works. The licensed establishment fees that we've talked an awful lot about. There's quite a bit of movement at the state level. We have our state association working diligently to prepare for 2025 legislative session, where we can ask the legislators to consider a fee increase. MACO is standing in support of that as well. That was a formal vote that they took at their MACO meeting. So I think we have some good strategies in place, and we're going to we'll get some momentum over this next year in preparation for 2025 session. So that's in the works. Other than that, I just wanted to keep you apprised of activities around budget planning. So, and some big kind of operational changes that you'll see happen with the department. Any questions on the budget preparation?
The commission is really appreciative of how hard Brent has worked on this to try to make it work, where we've had to do this throughout the whole county because of the way inflation is impacting us, and I'm sure you've seen the furor about potential property taxes going up, where a lot of our funding is located. So I think that the public just doesn't understand how important some of these things are, and at this point aren't willing to give us a lot of extra money. So we're trying really hard to get as much out of as little as possible.
Yeah, and inflation's hit everybody. So not just, businesses are feeling it and families are feeling it. And so to ask voters for an increase in taxes, it just doesn't, it's hard. So it's not great timing.
Yeah. So, thank you for what you're doing, though.
So more to come in the spring. We'll go through our normal budgeting cycle where the board will participate in looking at the budget in advance of kind of accepting it and making recommendation that the commission approve that. And that typically happens in the April timeframe. So.
Well, big kudos to you and the staff for all the creativity and flexibility and resilience. Changes are never easy. So thanks to all the staff and you, Brenda, for making it work.
A lot of sacrifices will be happening.
Yeah.
And so thank you for that. And we'll definitely make sure to pass on to staff how.
We do appreciate it a lot.
Yeah.
Mhm. It's very valuable work that people don't see. And so it's hard for people to understand the value of prevention when it never happened. And it's just this timeless challenge of how to communicate how valuable things are when they're not always seen. So thanks for doing the good work.
Thank you. And I left the last item for last because I wanted to end on a high note, but at the same time, it's bittersweet for us here at the health department.
And so I'm announcing that Kathy Moore has officially decided to retire. And she, you know, when I took this job 6 years ago, Kathy, the first thing she said to me was, I think retirement's out about 5 years. And then the next year she would say, I think retirement's about 5 years. And then the next year she said, I think retirement's about 5 years. And so she finally got serious and has actually planned her retirement and planned for a good year. She's prepped the health department for a year now or more. That division and the staff that she has been leading for the last 30 years, they're ready. She has made sure that she's coached them and mentored them and they're ready. They're ready to take on the future challenges of environmental health. And it's my guess that Kathy is also ready to launch into her next chapter. So, you know, after 30 years, 5 years, 30 years, 5 months, and 5 days, and it'll be 6 days tomorrow because tomorrow is her last day. Kathy has been dedicated to addressing environmental factors that have impacted human health here at Lewis and Clark Public Health. She's done that in a variety of capacities. She's been a sanitarian. She's worked the Water Quality Protection District, and the position that she's in now is a division administrator. She's been a dedicated leader, a coach, and a mentor to all of us. And so I will miss her greatly. She's left her mark. She's left a stamp on the health department, and her legacy will live on. What she has taught us and what she has given us with all of her time and her energy and her expertise, that is now a part of our fabric in this department. And so wanted to give the board an opportunity to wish her well as she moves into retirement. So. And she's with us virtually there.
Kathy, thank you. Go ahead.
Kathy, have any final words?
Right. You're muted, Kathy.
Oh.
Yeah.
It's really hard to find words. I think I have words, and then when I'm faced with the actuality of speaking them, they kind of vanish like smoke in the wind. This has been a marvelous experience. The people that I've met and the opportunity that I've had to serve the community has been incredible. And I am going to miss people so much. They're like family to me. So, but I gave them my cell phone, so I hear what they want.
You know, I think when it was announced on Tuesday that you were going to be leaving, Kathy, it was said best by Commissioner Hunthausen, who has worked with you the longest of any of us on the commission, how much you've done for our community and for the people of Lewis and Clark County. And he listed a whole myriad of ways you've impacted the county and made this a better place to live. And I have been able to see just a little bit of that in my short term here, but his experience was much longer, and with how effective you've been. And once again, I just really appreciate what you've done, and you've done more than I'll ever understand, and probably more than any of us understand, because you've been a steady person at the wheel for quite a while. Thank you.
Thank you.
I just want to say thank you. It's been fun working with you over the last 5.5 years, 6 years. So I didn't know you were going to retire when I joined the board, so I'm glad you stayed on. And best of luck in retirement. I don't know if we ever fully retire. Hopefully you will, but
Well, you know.
hopefully give him somebody else's cell phone number. So.
It'll be
Kathy.
a year and I'll get bored.
Maybe not. Thank you so much for all your service, Kathy, and most of all, besides all of the work that I feel like the work that environmental public health professionals do is just really hard for the general public to really understand even. It's so complex and you guys just all do it so humbly and so consistently. But from when I used to work with you and all this time on the board, just your like positive outlook and just like, you know, personality and smile, and just thank you for just being such a beacon for all these years for everyone, and wish you so much enjoyment in your next phase.
Thanks, Bree.
Mhm.
And unless the board has questions for me, that was my report.
Any questions for Brenda? Okay, well, with that, I'll close the Board of Health
Oh,
meeting. Oh,
We better.
oh,
do-
sorry about that. Public comment on matters not mentioned so far today.
I'm not seeing any.
Kathy's not quite into the public realm yet.
Soon.
Soon. Okay, well, now I will officially close the meeting. Thank you so much. Thank you.